treatment of autism really depends upon the functional level of the child. So for low-functioning children with autism, because they oftentimes have significant language and communication impairments, they really require very early intervention to help them begin to appropriately use receptive language or some kind of alternative communication strategy just to get their wants and their needs met. So basic needs like asking for food, making sure that they're comfortable when they want something, when they want a toy or a preferred object. And so to treat those individuals, you really have to dive in and use intensive behavioral intervention. You have to be prompting and reinforcing appropriate behavior so that you're really teaching them those communication skills and other skills as well, like how to dress themselves and pre-academic skills like how to sit quietly and pay attention to somebody who's presenting information. On the high-functioning end, because those kids are identified later, those kids have precocious language, they're very intelligent. So later on what we do is we really focus on social skills. And when you focus on social skills with those folks, you're really trying to get them to better understand interactions. And so you're trying to teach them how to have a better perspective taking on the world, how to look at other people and discern what their motivation is and how I should interact with them. How do I start a conversation? How do I appropriately end a conversation? If the conversation's trailing off, how do I try to rescue that conversation back so that it's appropriate? Those kinds of social skills, how close do I stand to somebody? Because social distance is a problem in people with Asperger's as well. On the medication side, there are no medications that actually treat the core symptoms of autism, social communication impairment and restricted repetitive behavior. Instead, we do have two medications that are both atypical antipsychotics that treat irritability associated with autism. So about 30% of individuals with autism at some point in their life will have irritable or aggressive or even self-injurious behaviors, for example, like skin picking or biting their own arm. On the aggression side, they might hit, or they might become really irritable and cranky and not want to do things and throw a tantrum really quickly if they're required to do something that they don't want to do. And for those individuals that have that irritable sort of problem or aggression problem or self-injury, there are these medications that can be helpful. Even in those cases, we oftentimes think of it as needing to pair the medication with behavioral intervention. So for many kids, we'll still want to do behavioral intervention. We'll still want to reinforce appropriate communication. So for example, if the child throws a tantrum and isn't appropriately communicating that they really don't want to do something, we'll not only have those kids use a medication to try to decrease their level of irritability, but we'll also use behavioral intervention to prompt and reinforce them using a communication strategy that gets across what they want and they need. So really, even if you use medication for irritability in autism, it's still important to use intensive behavioral intervention or other kinds of behavioral intervention strategies to help people to be less irritable and to develop behaviors that can replace those more challenging behaviors.